People often feel knee pain completely out of the blue with no clue to why the pain has started. Been no sudden pop, no fall, no twist, no bad tackle in sport. Something just went wrong. And I've had this several times before. I've woke up from football, my knees have just been sore. The knee may feel sore, irritated, stiff, just like you can't move properly, uncomfortable when doing daily tasks such as walking, just going out in general. This makes people worry, and that's quite common for people to think, have I damaged something? Should I stop doing the things that I want to do, like even just walking the dog? Or is this aging? I think that as well. You know, I'm getting into my 30s now. Well, I am in my 30s, sorry. So yeah, that crosses my mind too. But a little bit of reassurance, knee pain without injury is actually very common. It's more common than you think. It often relates to load and muscle support, not damage. I say often, I can't guarantee it. So if you have any doubts, please go see a physio. The knee doesn't just work alone, it relies on surrounding muscles. Those muscles are your glutes, so your butt muscles, your quads, your hamstrings, and your calves. They have several jobs. Some of them include control movement, they absorb force, they stabilize the joint, and if the muscles become weak, tired, or tight, then the knee ends up absorbing more load. Over time, that can lead to irritation or discomfort, and that's obviously not very nice. We don't really want that. But it's not usually something suddenly breaking. That's the important thing to remember. So let's talk about standing for long periods, because that's quite a common trigger for people. Jobs like healthcare, retail, construction, warehouse work. So jobs where people are on their feet standing for long periods. So effectively the knee has to support the body weight consistently. And the issue of that is, if the muscles are fatigued and you stay still, then irritation may build. May not, but there's a good chance it could. Many people notice pain later in the day or when they stand up from the sofa. I've done that before. I've got up and I thought, oh my God, my knees, they hurt. So that's quite a common thing as well. Let's talk a little bit about walking and repetitive load. So walking's very healthy. I always promote daily steps. I absolutely love walking my dog. However, every step, the foot hits the ground, the force travels up the leg, and the knee absorbs the load. If the muscles are fatigued, then more stress will sort of be placed on the knee, and people will notice discomfort after long walks, busy days, just being on their feet all day, and that's not very nice. We don't really want that. But the pain might not always appear straight away. It might appear later that evening or even the next morning. We've all got out of bed and thought, oh my God, my knees really hurt. Again, been there, done that several times. So hard surfaces, concrete, pavements, hard floors, they all equal more impact and less shock absorption for the knee. So for example, if you run 1 mile around the block, obviously you're going to create some impact on the knees, okay? But if you run 10 miles around, do a 10-mile run, then that's going to create even more stress on the knees, and that can lead to irritation. So it's really important to maybe try and wear the correct footwear if you are doing that. I mean, if you do run 10 miles all the time, then that's fine, you're used to it, but don't go from 1 to 100, don't go from 1 to 10 miles straight away, because you might get irritation, and you may ask yourselves, is something damaged? And quite often the answer is no. It may just mean fatigued, you've increased the load, gone from 1 to 10, and you've got reduced muscle support. And basically that's the body just signaling it needs some adjustments. Just need to make some small little changes. So I spoke about lots of things, but what actually helps? My advice is don't give up and rest completely, because too much rest can lead to stiffness and weakness, and we don't want that. There's a better approach: gradual movement, sensible activity levels, avoid sudden spikes in workload, so again, going from 1 mile to 10 miles straight away, and include gym-based training. So let's talk a little bit about that, okay? So strength and recovery. So stronger muscles will support the knee better, okay? So make sure you focus on those 4 muscles which I mentioned, so the glutes, the quads, the hamstrings, the calves. Get that leg day in. I absolutely love leg day because I know legs are my weakest part, so I get a good sense of feeling training legs. But it's also important to focus on recovery. I actually ice my knees every single day just to continue doing the things that I want to do. Other examples of recovery include good, just normal rest to balance it, and good sleep. I recommend 7 to 9 hours per night. Some people may use knee supports as well. We obviously sell them, and they can provide compression, stability, reassurance, And the most important thing to realise is they're not used as a standalone product. You'll need to tackle the root cause as well as having that support from the knee, from the knee support. So to summarise, knee pain without injury is very common, and it often relates to load, fatigue, and muscle support. Improving strength, managing your activity levels, and having a suitable recovery plan in place can help people stay active and more comfortable.